Most people believe a heart attack always sends a warning: chest pain, a numb arm, someone clutching their chest and falling to the floor. That's the version we've all seen in movies. But that's not how it usually happens after the age of 60. The most dangerous cardiac events at that age are often silent. They build quietly, over hours, while the body is completely at rest. No warning. No chance to call anyone. No second attempt. And here's the part that catches almost everyone off guard when they hear it for the first time. Those events are rarely triggered by something dramatic. They're triggered by something small, something so ordinary you'd never think twice about it. Something that happened quietly just before the lights went out. Tonight, we're going to walk through 5 of those quiet, everyday patterns. The ones that, without anyone realizing it, put extra strain on the heart while the rest of the body is supposed to be resting and recovering. And then, step by step, we'll look at how each one can be corrected starting tonight without turning your life upside down. Stay with me through this one. What you hear in the next half hour could matter more than almost anything else you watch this year. Let's start with something most people never think about. What actually happens inside the body once you fall asleep? The heart doesn't clock out for the night. It shifts into a different mode of operation. In a body that's aging well, nighttime is when blood pressure is supposed to drop, usually somewhere between 10 and 20% lower than daytime levels. The heart rate slows, blood vessels loosen up. It's essentially scheduled maintenance, something your cardiovascular system has quietly performed every night of your life without you noticing. But as the decades add up, that system starts to lose some of its precision. Blood vessel walls become stiffer and less elastic. The internal signals responsible for regulating nighttime pressure begin to weaken. And the safety margin, the buffer that used to absorb small errors, starts shrinking. Think about it this way. During the daytime hours, your cardiovascular system has backup options. It can reroute, adjust, compensate for stress in real time. At night, several of those backup systems go quiet. The body runs on a smaller crew, handling fewer resources with less oversight. That's the reason the hours between roughly midnight and 6 in the morning carry the highest statistical risk of heart attack and stroke for people past 60. Not rush hour, not a stressful afternoon at work. The quiet hours, when nobody is watching, but your habits from the evening before are still very much active. And here's the detail that changes the way most people think about their own risk. What unfolds during those overnight hours is largely shaped by decisions made hours earlier. What was on your plate at dinner? Whether a medication was taken, delayed, or skipped. The temperature of the room you fell asleep in. Choices that felt completely unremarkable in the moment. Let's go through them, one at a time, starting with the one that surprises people the most when I bring it up during a consultation. When did you eat dinner last night? And what was actually on the plate? I ask almost every patient over 60 some version of that question. And for a surprising number, the honest answer is somewhere close to 8, 9, sometimes even 10 at night. A full plate, pasta or rice, a portion of meat, occasionally something fried, followed by an hour or 2 on the couch, then straight to bed. I understand exactly why this happens. Long workdays, family schedules that don't cooperate, a habit built up over decades. But from a cardiovascular standpoint, this pattern quietly works against the heart, night after night. Here's the mechanism behind it. A large meal forces your digestive system to demand a significant increase in blood flow. Your heart has to work harder to meet that demand. Blood pressure climbs. Triglycerides, the fat circulating in your bloodstream, spike sharply within 2 to 4 hours of eating. Now layer that directly on top of falling asleep. Your body expects the evening to be a gradual wind down, not a full-scale digestive operation running at the same time it's supposed to be shifting into recovery mode. Those two processes are pulling in opposite directions. In someone with even mild arterial stiffness, which becomes more common with age, that tug of war has real consequences. Research in this area has repeatedly pointed to the same pattern. Eating within 2 to 3 hours of lying down is associated with higher nighttime blood pressure, more frequent acid reflux that can closely mimic cardiac symptoms, and an elevated risk of cardiovascular events occurring during sleep. The fix here doesn't require a complicated diet overhaul. Aim to finish your main meal by 6 or 7 in the evening. If you need something later, keep it light. Lean protein, vegetables, and steer away from heavy, fatty dishes close to bedtime. Does that dinner pattern sound familiar to you? You might be surprised how many people recognize themselves in that description and have never once connected it to their heart health. Now, the second habit, and I need you to take this one seriously because this is where I've seen the most preventable damage occur. If you're over 60 and taking medication for high blood pressure, and statistically, more than 6 in 10 people in that age group are, the timing of that medication matters far more than most people realize, and more than many doctors take the time to explain during a routine visit. For most people, blood pressure follows a predictable rhythm across the day. It rises in the morning, peaks sometime in the afternoon, and dips overnight. But a meaningful portion of people over 60, especially those already managing hypertension, don't get that nighttime dip. Their pressure either stays elevated through the night or actually surges in the early morning hours. This pattern has a name: nocturnal hypertension. Most patients have never heard the term, and it behaves very differently from ordinary daytime high blood pressure. While you're asleep, your arterial walls aren't braced the way they are during waking hours. A pressure surge at 3 in the morning strikes those vessel walls very differently than the same surge would at 3 in the afternoon. It's more likely to disturb a vulnerable plaque inside a coronary artery, more likely to trigger clot formation, more likely, frankly, to end with someone on an operating table. If your blood pressure medication is taken only in the morning, its protective effect may be wearing off by the exact hours you need it most. And if a dose is missed altogether, you may be entirely unprotected during the most vulnerable stretch of the night. So what should you actually do? Bring this up with your doctor directly. Ask specifically whether your particular medication might be more effective taken in the evening rather than the morning. That conversation takes 2 minutes and could meaningfully change your risk profile. Clinical research, including large chronotherapy trials looking specifically at evening dosing, has suggested that shifting blood pressure medication to nighttime can meaningfully reduce cardiovascular risk during sleep. That's not a minor scheduling tweak. That's a conversation worth having at your very next appointment. Don't assume timing is irrelevant. In cardiology, timing is very often the entire difference between a protected night and an unprotected one. I think about a patient I'll call Miriam, 68 years old, who had been on the same morning blood pressure pill for almost a decade. Her readings at the clinic always looked fine. It wasn't until a home monitor showed her numbers climbing overnight that we adjusted the timing of her dose to the evening. Within weeks, her overnight readings normalized. Nothing about her diagnosis changed, only the clock. Now, I want you to picture someone in your life who snores. A partner, a parent, maybe it's you. That loud, uneven rumbling that fills a room at night. Most people brush it off as background noise, something to joke about at breakfast. I don't treat it that way. After 2 decades in this field, I treat heavy snoring as a cardiac warning sign until proven otherwise. Sleep apnea is one of the most underdiagnosed conditions I encounter in patients past 60. Current estimates suggest that roughly a third of older adults have some form of it, and the overwhelming majority have never been formally diagnosed or treated. Most have no idea what's happening inside their chest every single night. Here's what actually unfolds during an apnea episode. Breathing stops. Sometimes for 10 seconds, sometimes for 40 or longer. And this can repeat dozens of times in a single hour. Each pause causes blood oxygen to drop sharply. The brain interprets this as an emergency and fires off a stress response. A surge of adrenaline and cortisol, a sudden spike in heart rate and blood pressure. The heart essentially jolts awake while the rest of the body remains asleep. Now multiply that by 30, 40, 50 times a night, repeated for years. The cumulative effect on the cardiovascular system is anything but subtle. Sleep apnea has been associated with a 3-fold increase in heart attack risk. That figure alone deserves your full attention. It's also strongly linked to irregular heart rhythms, including atrial fibrillation, which itself substantially raises stroke risk. Over time, it contributes to the thickening and stiffening of arterial walls. And because the person experiencing it is unconscious for all of it, they often have no idea until something serious happens. The warning signs aren't always the loud snoring people expect. Watch for waking up with headaches, feeling exhausted even after a full 8 hours in bed, needing to get up frequently during the night to use the bathroom, waking with a dry mouth, or an occasional sensation of choking. If any of that sounds familiar, it's worth raising with your doctor and asking about a sleep study. Here's what I tell patients directly in clinic. If you snore heavily, you're over 60, and you carry any history of heart disease or stroke, getting evaluated for sleep apnea isn't optional anymore. It belongs in the same category as your cholesterol panel or your blood pressure check. It's part of taking your cardiac health seriously. The most common treatment, a CPAP device, isn't glamorous, and I won't pretend otherwise. But the data behind it is remarkable. Patients who use it consistently show measurable drops in blood pressure, reduced rates of atrial fibrillation, and meaningfully lower cardiac risk overall. One device, one nightly habit, a substantial layer of protection. Does anyone in your household snore heavily? Have you ever been told you stop breathing in your sleep? Sit with that question for a moment before moving on. The next habit is driven by something completely reasonable, and that's exactly why it slips past so many people unnoticed. A lot of people past 60 deliberately cut back on fluids in the evening. The logic makes sense on the surface. Nobody wants to wake up at 2 in the morning to use the bathroom. Getting up at night disrupts sleep and increases the risk of a fall in the dark. So fluids get restricted after dinner, sometimes as early as 4 in the afternoon. I understand the reasoning completely. But from a cardiovascular perspective, going to bed even mildly dehydrated is a real risk factor, and it's one that almost nobody discusses. When the body is dehydrated, blood becomes thicker, more viscous. It doesn't move through the vessels as easily. In a younger cardiovascular system, that's a manageable inconvenience. In someone dealing with arterial stiffness or existing plaque buildup, it's a very different situation. Thicker blood moves more sluggishly through arteries that may already be narrowed, and it's more prone to forming clots. Here's the timing problem most people never consider. During sleep, heart rate naturally slows, and circulation already moves more slowly than during waking hours. Now add thicker blood on top of that, in a body that's been lying still for 7 or 8 hours, in vessels that may already have some degree of disease. That combination, dehydration, a slowed heart rate, stillness, and vascular wear, is one of the reasons strokes and heart attacks cluster heavily in the early morning hours. The fix is genuinely simple: a single full glass of water before bed. Not a large volume. Roughly 8 ounces is enough to keep blood from thickening unnecessarily overnight. Keep a second glass on your nightstand for that moment you wake up feeling mildly thirsty. Your body is asking for something your heart needs just as much. You don't have to choose between uninterrupted sleep and cardiovascular protection. A small adjustment covers both. Now, for something that sounds almost too simple to matter, which is exactly why almost nobody thinks about it. What temperature is your bedroom at night? Most people think about bedroom temperature purely in terms of comfort. Almost nobody thinks about it in terms of what it's doing to their heart. But there's a specific range your cardiovascular system prefers, and outside of it, your heart quietly works harder than it needs to. Start with a room that's too warm, somewhere above roughly 22 degrees Celsius, about 72 Fahrenheit. Your body works throughout the night to dissipate that extra heat. Blood vessels dilate. Heart rate stays elevated longer than it should. Sweating increases, which brings us right back to the dehydration issue we just covered. And sleep quality itself declines. You spend less time in the deep, restorative stages where the heart does its best overnight recovery work. Now, the opposite extreme. A room that's genuinely cold, below roughly 16 or 17 degrees Celsius. Cold triggers vasoconstriction. Blood vessels tighten to preserve core body heat. Blood pressure rises as a direct result. The heart has to push against greater resistance to move the same volume of blood. For someone already managing coronary artery disease or hypertension, that added nighttime pressure isn't trivial. The range associated with better cardiovascular protection during sleep sits between about 18 and 22 degrees Celsius, roughly 65 to 72 Fahrenheit. That window keeps the body in a neutral thermal state. Vessels stay relaxed, heart rate stays low and steady, and sleep stays in its deeper, more restorative stages. One thermostat adjustment. Real, measurable protection. Everything we've covered so far might sound like a growing list of things to worry about. I want to reframe that completely because when you put all 5 pieces together, what you actually end up with is a simple blueprint, a practical evening routine that addresses every single one of them at once. I call it the heart-safe evening routine, and it fits into an ordinary life without requiring dramatic changes. Here's what it looks like in practice. Between 6 and 7 in the evening, that's your window for the main meal. Lean protein, vegetables, a moderate portion of carbohydrates if needed. Not a feast, not a fast. Just a proper dinner at a reasonable hour, giving your heart 3 to 4 hours to settle before sleep. If you're still building this habit yourself, a quick like on this video genuinely helps more people find it. Now let's keep going because there's more worth covering. Around 7, that's the moment to handle water and medications. If your doctor hasn't specifically discussed the timing of your blood pressure medication with you, consider this your reminder to bring it up. Evening dosing may offer meaningfully more protection for some patients. Between 8 and 9, that's your wind-down window. A gentle walk, some quiet reading, a calm conversation with someone you care about. This is also the time to step away from bright screens, particularly phones, since that light suppresses melatonin and keeps the nervous system alert longer than it should be before sleep. By 9, check your bedroom. Adjust the thermostat if needed. Crack a window briefly if the room feels stuffy. Set a glass of water on the nightstand. None of this takes more than 90 seconds combined, and it matters. By 10, you're in bed. And here's one final detail that costs absolutely nothing. If you snore, or if you've ever been told you stop breathing during sleep, try sleeping on your side rather than on your back. Back sleeping tends to worsen airway obstruction considerably. That single positional change can meaningfully reduce apnea episodes while you work toward a formal evaluation. Dinner by 7. Water and medication reviewed. A calm evening until 9. Bedroom prepared by 9. In bed by 10, on your side. Whether this routine works isn't really the open question. The research consistently points in the same direction. The real question is whether you'll actually put it into practice, and that part is entirely up to you. I want to take a moment to be direct with you, not as someone presenting information, but as someone who has spent years listening closely to patients living through exactly this. I've sat across from families in waiting rooms at dawn, families who had no idea anything was wrong when they said goodnight just hours earlier. I've reviewed case histories where the contributing factors were never mysterious. A late dinner, a missed dose, a bedroom that ran too warm, a body that had been quietly low on water for hours, an airway that had been struggling silently for years while everyone assumed the snoring was simply snoring. These aren't rare, exotic risk factors. They're the background noise of millions of completely ordinary evenings. And that background noise, repeated night after night, year after year, can eventually add up to something serious. Something that, in hindsight, had warning signs all along. Most cardiac problems I've encountered over the years didn't stem from bad luck. They stemmed from a lack of information. Information patients simply never had access to in a clear, practical way. Now you do. What matters is what you choose to do with it starting tonight, not next week, not after your next checkup. Let's bring everything together into one clear plan. 1. Finish your main meal by 6 or 7 in the evening. Not a radical diet, just a sensible dinner at a sensible hour. 2. Talk to your doctor specifically about the timing of your blood pressure medication. Ask directly about evening dosing. That single conversation could be the most valuable medical discussion you have all year. 3. If you snore heavily, wake up exhausted, or have ever been told you stop breathing at night, ask about a sleep study. Past 60, this isn't optional. It's part of taking your cardiac health seriously. 4. Drink a glass of water before bed and keep one within reach overnight. Don't let dehydration thicken your blood simply to avoid a bathroom trip. 5. Keep your bedroom between roughly 18 and 22 degrees Celsius, 65 to 72 Fahrenheit, a simple setting that protects your vessels and costs you nothing. Now, I want to ask you something directly, and I'd genuinely like you to answer in the comments below. Which of these 5 habits do you recognize in yourself? I have a strong feeling at least 2 or 3 will feel uncomfortably familiar. You're not alone in that. Most people watching this will see themselves somewhere on this list. The difference now is that you know exactly what to do about it. Where are you watching this from? Drop it in the comments below. I always enjoy seeing how far these conversations travel. If this video gave you something useful, consider sharing it with someone in your life. A parent, a spouse, a friend, past 60 who has never once connected their nightly habits to their heart health. A single share can start a conversation that genuinely changes someone's evening routine. I'm Josephine, and this is Dr. Josephine Healthcare. If today's video helped you see your evenings a little differently, subscribing helps this channel keep bringing you clear, practical health information you can actually use. Take care of that heart tonight. It has quietly worked for you every single minute of every single day of your life. Give it the conditions it needs to keep going strong. Everything shared in this video is general health education based on current research and clinical understanding, not a substitute for personalized medical care. Please talk with your own physician before making any changes to your medication routine. Good night, and take care of yourself.